I have the privilege of getting to introduce Dr. Tony Jimenez to you. This is a man that over the last few years I've gotten to know, and the biggest thing that I've seen in this wonderful man is his heart. He has a heart for people, and he loves people very deeply. And his greatest mission in this world is to see people healed and well and whole. And I have never known a doctor that is more dedicated, that is more intelligent, that is more learned, but most of all more loving and caring than Dr. Tony Jimenez. And it is with great pleasure that I introduce you, sir.
Thank you for that introduction. I'd like to thank the ones that made this happen. And Jehovah Rapha, right? The Lord is our healer. That was actually the first name of our clinic, Hope4Cancer, was Jehovah Rapha. 18 years ago, we had a patient, and she was very ill, and I was just opening the clinic. And she wanted to stay at the clinic, be our first patient. I said, Gwen, the clinic is not open yet. She said, it doesn't matter. I could stay there. I could finish cleaning up before you do the grand opening. And her husband, Sylvan, joined in. We didn't have a nurse. We didn't have anything. We hadn't opened yet. And so we huddled together, the three of us, Gwen, Sylvan, and I. And in the prayer, Gwen said, what's the name of the clinic? And I said, oh, we don't have a name yet. And in prayer, she said, Jehovah Rapha. She said, Rapha Clinic. And at the time, I didn't know what that meant. But right away, I did know that that was going to be the name of the clinic. So that's 18 years ago. It was called Rapha Clinic. And then we switched the name to Hope4Cancer because more people understand that. The last time that I spoke at a church was in South Africa, in Johannesburg. And it was a church of about 10,000 attendees. And Freddie, the head pastor, he was my host there in South Africa. He sat me up in front, and there was a choir of about 150 people. And Freddie called me up, just out of the blue. He said, Dr. Tony, tell us something about nutrition. And I'm like, what can I speak about nutrition in South Africa when there's so many people that can't afford, food? So, I said a brief 10-second prayer when I got up to the podium. And so I just started speaking, and the choir in back, they would say, Hallelujah, praise the Lord, amen. And it was quite of an experience. So if you want to say that while I'm speaking, you can. Amen. Yeah, brother. So, because all the glory is to God. And today we're going to talk about the 7 key principles of cancer therapy. You'll see there the outline. Why Hope4Cancer? What is cancer? Because oftentimes when someone is given a diagnosis of cancer, they don't understand what cancer is. And I'd like to ask, is there anyone here currently with the diagnosis of cancer? Can you raise your hand? So quite a number of you. And who here knows someone that has cancer? Right? Everyone. And the story started with my dad. He was living in Pasadena, Texas, pretty close to here, right? I grew up in New Jersey. I was born in Colombia, South America. And I went to college in Dallas at the University of Dallas in Irving, Texas. So I'm a Cowboy fan. Sorry for the Texan fans in here, but so my dad was diagnosed with prostate cancer, stage 3. He went to MD Anderson before he told me anything. I was already a practicing doctor in Mexico. And after his first Lupron injection, that's to castrate you, right, to lower the hormone, he felt terrible, and he called me and said, son, this is what's been happening. I was diagnosed with prostate cancer, and I did this injection. And so I said, Dad, give me 5 minutes, and I'll call you right back. I hung up the phone, I cried, and then called him back. And then I said, okay, Dad, let's come to Mexico. and we'll start working on this. My dad was in his early 60s, and he lived to be 83, and he passed away. He passed away from heart disease at the age of 83. And even him passing away from heart disease, he had 2 open heart surgeries, and the doctors had told him that his heart was like an old sponge. Imagine a doctor telling a patient that your heart is like an old sponge. So my dad said, "Well, what does that mean, Tony?" And I said, "Don't worry, Dad. He has his sponges mixed up or something." So even with that severe heart disease that he had, he lived far longer after he had overcome the prostate cancer diagnosis. So, as was said, with 2 brilliant people that were up before me, Sherry, who I love dearly, and Dr. Brett, who we met yesterday. Thank you for your words. Cancer is not a death sentence. By the way, I would like to clear something up that Sherry said when she said when the doctor told her she was terminal and she's not terminal. We are all terminal. Right? The fact is we are all terminal. And when a doctor says you're terminal, maybe tell the doctor, well, you're terminal too. We're all terminal. And we don't decide when that is. God decides that. We had a patient that thought it was his time to die. It was very advanced cancer. And we took him in just to give him love, to give him support, and maybe to improve his quality of life. So one day, his wife was in the room, the nurse was in the room, and I was in the room. And the patient was in bed, and he said, "Dr. Tony, it's time for me to die." So he closed his eyes, and then he opened them up about 5 minutes later, and he's looking around, and we're like, "Hi," and I'm just sitting here. So I kid you not, he did that for 2 hours. 2 hours. And of course, it wasn't his time. I think he passed away 2 weeks later by God's time, not our time. And so we're going to see what cancer is about. We're going to talk about the 7 key principles. And I think they gave me 4 hours to speak this one. No. We'll open it up for question and answers. Some of the slides are a little complex, so I will just not talk about them too much. What is Hope4Cancer? You know a little bit of how we started Hope4Cancer. Another interesting story, and maybe my wife Marcy will speak about this when she opens up the afternoon session, but 17 plus years ago, there was a little girl that was 6 years old that came to our clinic fleeing chemotherapy with a diagnosis of leukemia. And her mom, Marcy, brought her to our clinic, 6 years old. She didn't want her daughter to receive chemotherapy. Imagine, first of all, if she survived it, she probably wouldn't have children, right? Because of the chemotherapeutic side effects. So, fast tracking the story, 3 years ago, I walked Whitney down the aisle. And now Whitney has a 9-month-old baby, Beckham. And when I saw Valor last night at the great dinner that Joy and Will put together, it was like, wow, these children are so beautiful. When I hugged Valor, he gave me energy. He gave me energy. So children are full of energy, and also hug a tree. A tree will give you a lot of energy. So we know that in the early 1970s, President Nixon declared a war on cancer, right? We all heard that. He put a lot of money into that. And some of the people that talked about this in those days, they say, why don't we try to conquer cancer by America's 200th birthday? That was in 1976. And what a holiday that will be. So we definitely know that didn't happen. And we know even Newsweek magazine, Lester made an ad, which was what is the seed, which was the seed for President Nixon's famous war against cancer. And Nixon allotted $100 million for cancer research. And on December 23rd, 1971, President Nixon signed the National Cancer Act into law. So what is the reality today? Today we see that cancer is the second largest killer in the world. 8.8 million lives were claimed in 2015 worldwide. 8.8 million. It continues to grow at epidemic proportions. 70% increase in cancers, new cancers will be seen by the year 2030. And 45% increase more in people dying of cancer. Of course, these are not people that are thinking about coming to Hope4Cancer, right? These are people thinking about toxic therapies. So cancer will kill twice as many people in 2030 compared to 1968. And we're coming very close to cancer death, mortality, passing the death rate of heart disease, which for many years has been #1 killer, heart disease. Now cancer is on the verge of causing more lives than heart disease. And of course, cancer knows no boundaries. It's hard for you to read this, but you know, the U.S. government spends over $500 billion on cancer research and work, and we're really losing. We have lost the war because the red line here indicates, like, from the 1960s to 2010, what has happened to the cancer rates, and you can see very little decline, right? So more people are being diagnosed with cancer, and really the survival rate hasn't changed much. And if you compare that to other types of pathologies, heart disease and pneumonias and things like that, that medicine has done really well at. You know, my chief science officer helped me with these slides, so they're very complex. He's a double PhD. And that's an interesting story because Subhrata Chakravarti, we met at a Walmart in San Diego. So we were looking for something, his kid and my kid started playing, and so we started talking. He gave me his business card because he worked for a pharmaceutical company. And I told him I was a doctor. He was researching chemotherapeutic agents, Taxol and other chemo agents. So in a couple of months, I had him working for me as a freelance medical writer. And a few years later, he joined Hope4Cancer. That's when I say that he saw the light. And now he is so blessed that he can see our work help patients and people. Because as a scientist, he would be in the lab developing better drugs, but he never saw really what happened, right, at the end result of his research. So we see that the incidence, projected incidence of cancer has increased significantly, and the deaths also are increasing. And when someone is diagnosed with cancer, you heard about the stages, right? Stage 1, Sherry said that when she was diagnosed, she was stage 1, and she said, great, that's the earlier stage. But we know that as the stages increase, from localized stage 1 to regional, stage 2 or 3, to distant metastasis to the liver, to the brain, to the lungs, to the bones, the survival rate decreases significantly, okay? And this is, all this is published. This is according to the National Cancer Institute, and this is epidemiological studies that are done there. You see, this is by different types of cancers. Breast cancer, when it is in early stages versus when it is in late stages. And you see how the death rate and the survival is much decreased when there is metastasis. The interesting thing about this is that there were studies done in Australia, multi-center studies, when they said that the 5-year survival for chemotherapy, with chemotherapy, only increases by 2.3%. So someone who has cancer, if they have chemotherapy, their survival rate is at best improved by 2.3%, and in the U.S. by 2.1, because in the U.S. they tend to be a bit more aggressive. As Sherry said, she lost all her hair and all that. So, and this is not me saying this is published in the Clinical Oncology Journal, and that was published in 2004. So why don't people really look at these studies, right? And then they come to Hope4Cancer, and they say you're going to a doctor who's a quack, he's a charlatan, and then there's things on Facebook, saying that negative information. And we know that these are what's called trolls. They're automated things that the pharmaceutical companies are paying to trash people that are doing the work that Dr. Brad and I are doing. Dr. Bill is here also. It was a pleasure to meet you yesterday. Dr. Bill in the back there. And he says, legally, I do this, but I help patients, so I do all this, right? And that's the reality. I'm a U.S. citizen, I'm a Colombian citizen, and I'm a Mexican citizen, and we live in San Diego, but we have to do this type of work in Mexico, right? So that's the reason that our clinics are in Mexico. And side effects of chemotherapy, I don't have to tell you much about this, and this is just a partial side effect. Fatigue, quality of life issues are incrementally more so the more and more chemotherapy that someone receives. So look at this. This is interesting. On the left, we have stage 1, 2, and 3, and 4. This is what conventional medical oncologists take care of. When you're diagnosed with cancer, then you could be in any of these stages. Then they have conventional therapies. Then when those fail, they come to Hope4Cancer when they're told there is no hope. And that's when they're in stage 4 and they have serious side effects due to chemotherapy. Those are the types of patients that we see. And oftentimes they say, well, they compare our statistics to the statistics that they have. But they're comparing statistics in earlier stages versus the type of patients that we see. And at the moment, I'd like to, where's Lucinda? Lucinda, if you could please stand up. I just want us to give her a round of applause, and her beautiful family. Thank you, Lucinda, who drove here from Oklahoma, right? Oklahoma. And if I could tell a little bit of your story, she was diagnosed with an astrocytoma. It's a very aggressive type of brain tumor, and at most 6 months to a year, sometimes 3 to 6 months. And they offered her the standard treatment, chemotherapy, radiation, and she refused that. And we're blessed and give God all the glory that she came to Hope4Cancer, and here she is. Here she is. And sometimes it's hard to step outside of the box, right? Because you have loving people that are telling you to do chemo and do radiation. And I want to also applaud Lucinda's husband because, as Sherry said, without that support group and the love, the positive thinking of the community, the church, the family, it's hard, isn't it, Lucinda and Sherry and those of you who are going through that challenge. I called it a challenge. I didn't call it cancer, right? Because as Dr. Brett said, information is very powerful. Every cell in our body has information. And when we say negative words, that's the information that we're receiving. So very important. So in summary, this is 92% of the patients that come for Hope4Cancer are stage 4, and they failed all conventional therapies. And when you compare that with conventional medicine, 33% of their patients are stage 4 upon diagnosis, stage 3 or 4. In lung cancer, 65% are in stage 3 or 4. In colon cancer, is 22%. And in prostate cancer, only 7% of the patients that go to the oncologist at initial diagnosis are in stage 4. Is that understandable? Because this is important, right? As we see the choices that are made in medicine. So we did a 365 patient third party study. That means we just gave the charge to a third party, not affiliated with Hope for Cancer, to analyze the data. And this is the data that I want to present to you. This was so far it's a 2-year study with 365 patients. Of those 365 patients, 92% were in stage 4. And the 2-year survival was 79%. 2-year survival. The estimated 5-year survival will be 77%. And I say estimated because this study is ongoing. And there are statistical calculations that are set forth by the National Cancer Institute of how you could extrapolate and estimate this data for 5 years, okay? So next time we're here, the numbers won't be estimated. They will be actual, real patients as we continue to study these patients, okay? And this is Whitney that I mentioned earlier, my daughter now, my daughter for many years. And interesting, one night I went to see Whitney and she was having a blood transfusion and she said, "Doctor, don't leave me." And I said, "Don't worry, I'll never ever leave you." But I didn't think it was really never ever, right? Because Marcy and I got married and I'm her dad. And now she gave us our first grandson, Beckham, and Evan is her husband. And this was my dad, my mom, and myself. And that picture was taken in Bogota, Colombia. Maybe I was 2 or 3, I'm not sure. My grandmother just passed away a year ago at the age of 103. So when she was 100, I asked her, "Grandma, tell me your 3 secrets or tips to longevity." And she said, "Okay, be in bed by 9 o'clock." And so I started to think about that, and we know from research that from 10 p.m. to 2 a.m. is when the body heals, repairs, and regenerates. So who here is in bed by 10? Wow, pretty good. Because you're country folks, right? No. But we need to work on that. Because now we know that the brain has an immune system. When we went to medical school, we were told the brain doesn't have an immune system. So now at the University of Iowa, it was clearly discovered that the brain has an immune system. So when we're sleeping, specifically between 10 p.m. and 2 a.m., the brain is regenerating. Hopefully those negative thoughts, Dr. Brett, are being eliminated also, right? Don't watch the news before you go to bed either. It's all bad news. In San Diego, they made an all good news radio station. How long do you think that was on the air for? I think 6 months, and it went broke because no one would listen to it, so there was no sponsors and no advertising. So let's get into the good news habit. So my grandmother, number 1 was be in bed by 9. Number 2 was eat at the same time every day, your 3 meals. And believe me, the times I was visiting my grandmother in Colombia, if her breakfast was not there at 7:30, we would all know, right? So whatever your time is, try to eat regularly and consistently. And number 3 was a 4-letter word. Anyone guess what that is? Love, right? Very easy, love. And so those were her tips to longevity and health. She took only half of a blood pressure medication. And at 103, one day, she felt a little dizzy. My uncle, her son, took her to the clinic, to the hospital in Colombia, and a week and a half later, she passed away. To this day, I believe it was a medical mistake, but, you know, that's what happened. So there's many faces of hope. And in the afternoon, we'll play a little video, a short video called I Am Hope. I'm not sure what we're going to do with those t-shirts, but there's some t-shirts of I Am Hope outside. So maybe like a raffle, because I don't think we have enough for everyone. So we'll give them out. Tatiana, can you stand up? You have one of the I Am Hope t-shirts, right? Yes. So we have a few out there, and our beautiful model. So we have some outside that we'll share with you. And this is our core values at Hope4Cancer, and I think the core values of all church-going people, and Dr. Brent mentioned some of them: faith, hope, love, and generosity. Gratitude comes in here as well, right? So faith, hope, love, and generosity. And that's what it takes to heal and to maintain health. So what is cancer? We have ideas of what is cancer. Cancer is intelligent. And everything I'm saying here is well documented. It's in the literature. It's published in peer-reviewed journals. Cancer is intelligent. Cancer exhibits social behavior. It solves problems of existence. It mutates. It adapts to survive. It alters its own genes. It hides from the immune system. That is a very important one, because now we know that cancer cells cloak themselves or shield themselves from your immune system. So you might be taking supplements or products to help your immune system, and that's great. But we have to go a step further. We have to be able to allow the immune system to see the cancer cells and mount an immune attack. Because remember, the immune system protects us from a cold to cancer and everything in between, right? It recruits healthy cells. It was found that from the cell wall of cancer cells, and the ropers in the room will relate to this, it's like a rope that comes out of the cell membrane, and that rope lassos in healthy neighboring cells. So cancer is not a bad luck or accident that someone has it. Any of you here ask your oncologist, doctor, why did I develop this cancer? Anyone? Of the ones that, can you say, ma'am, what did the oncologist say when you asked him that question?
Well, probably bad luck.
Bad luck?
That's exactly what he told me.
Yes. Anyone else?
He told me it was the head of MD Anderson surgery, the head guy. He said, what happened 7 years ago in your life that, upset you, that's what.
Wow, that was a good guy.
That was the first one around. Of course, he's come back and he's retired, but.
Right.
But,
Yeah, so now we know that cancer is intelligent. It's not bad luck. It's not an accident. And as we go further in this talk, we'll talk about the characteristics or hallmarks of cancer. Why did cancer develop? And maybe some of you, your oncologist asked you, did your brother have cancer, your sister, your father, your mother, right? Some of you were asked that question. And if you say yes, the oncologist will say, that's why you have it. But if you say no, there's no cancer in my family, then they say, something else. It's bad luck, or it's in your cards, or some even say, well, God gave it to you. Or we know that God doesn't give us disease, right? So genes only account for 2.5% to 5% of all cancers. So please don't believe that because your mother, your father, your cousin, your aunt, your uncle had cancer, you are doomed to get cancer. Because it's not about the genes. It's about, and this work was done by Dr. Bruce Lipton. I'm sure some of you have heard his work, The Biology of Belief, right? Was one of his books. And he's a geneticist. And so the genes account for very few cancers. The rest of the cancers, which is 95%, are what's called epigenetics, right? And you heard that word. Epigenetics is environmental, toxins, nutritional, water, negative thoughts. I said on The Truth About Cancer docuseries that a negative thought can kill you faster than a bad germ, right? So it's very important, our mindset. So cancer indeed is not genetic. If you go into a room, you know where the light switch is. So you turn that light switch on. What happens if you go into that room and the light switch is not there? Then you're going to do this till you find the light switch and turn it on. So we all have genes that can potentially lead to a cancer diagnosis, but let's not turn those genes on, right? And that's what we're going to learn today, some of the things that will help us either not turn those genes on or shut those genes off, okay? A few other things is that cancer cells create their own nutrition. They have a lot of blood flow, blood supply to get in more nutrients and to eliminate waste. That's called, in medicine, that's called angiogenesis, okay? So one of the main therapies that all of you should have is to decrease that blood supply to the tumor. And in conventional medicine, there are a few chemotherapeutic drugs. The most commonly known one is called Avastin, and that's a chemo that stops the blood supply. However, it's very toxic, and people get peripheral neuropathy, numbness of the fingertips or the toes, right? So we do that naturally and non-toxically. And cancer cells also learn how to resist chemotherapy. And so one thing to know is that a tumor or a lymph node that has cancer has two types of cells. The majority of them are called non-cancer stem cells. Non-cancer stem cells. That makes up about 99% of the tumor. 1% are called cancer stem cells. Only 1%. The non-cancer stem cells are sensitive to chemo and radiation. So any of you who have had chemo and or radiation, or people that you know that have, the doctors say good response, you're in remission, or the tumor has shrank significantly. That's because these 99% of non-cancer stem cells can be sensitive to chemo. So you have significant tumor reduction. The 1% are called cancer stem cells, and they are resistant to chemo and radiation. Chemo, radiation will never, and I did use the word never, never will kill cancer stem cells. That's well documented, well known. And so these are the guys that metastasize. They're the ones that leave the breast and go to the lungs and go to the liver and the brain and the bones. These guys, the non-cancerous stem cells, they cannot metastasize because they cannot survive in the bloodstream or in your lymphatic system, okay? So when you are told that you're in remission or you know someone, advise them to be very careful because the chemo didn't kill these cells. And so there's natural therapies that can attack and kill these cancer stem cells. So when a PET scan is done, an MRI, a CAT scan, an ultrasound, that cannot detect these cancer stem cells because we're very small, very few in number, but these are the ones that come back. But then you might say, Dr. Tony, I know someone who had cancer and they had chemo and or radiation and they're cured. Maybe some of you know someone like that, right? So how did that happen if the chemo and the radiation didn't kill the cancer stem cells? What happened there is that the person's own immune system and maybe the mindset was able to eliminate these cancer stem cells because the chemo will never kill these cells, okay? Another thing is, when you're told you're in remission, there's a test called circulating tumor cells, CTC, and that's done in a lab in the US called Cell Search, C-E-L-L, Search. Cell Search. So you call them, they send you the kit, you go to a local doctor or lab, they draw your blood, and you send the blood to Cell Search lab. And 2 or 3 weeks later, they will send you a report, of how much circulating tumor cells or cancer stem cells there are in your blood. And right away you will know your risk factor for having what they call a recurrence or a relapse, or the cancer came back. I believe the cancer never went away because it didn't kill these guys, right? So the low number of cancer stem cells finally made a bigger tumor that now is the cancer came back. Okay, is this making sense? Yeah. So circulating tumor cell count is very important. You could ask your oncologist will never ask for this test, or maybe I shouldn't say never. We'll very rarely ask for this test because he or she do not have a treatment to give you that can kill the circulating tumor cells or the cancer stem cells, so why do that test, right? So you have to go to your naturopathic doctors, your chiropractors, to have this test done. Or you don't even have to go to, a doctor. You could call the lab and then go to the doctor to get them to help you with the interpretation, okay? So as you go forward in your treatments, the circulating tumor cells become very important. If you were just recently diagnosed, it's good to do as a baseline, and then later on you could do another one and then compare the two. Okay. So here it is. These are the cancer stem cells that I was just talking about, that they initiate tumors. They're the ones that become resistant to treatments like radiation and chemo. And they break away from tumors and they lead to metastasis, what I just explained, right? Those are called cancer stem cells. All of us in this room are forming or developing about 100 to 150 cancer cells every day, and our immune system is taking care of that. So what you've learned this morning and what you learned from me and later today are things that we can do to decrease the likelihood of those cancer cells that are forming every day to develop into a tumor or metastasis. Cancer is a metabolic disease. This is one of the most important books that have come out in the last decade, in my opinion, by Dr. Thomas Siegfried out of Boston College. And he said cancer is a metabolic disease that needs metabolic solutions for its management and prevention. He didn't say that it needs chemotherapy for its solution or radiation. There's a great Christian lady, a doctor from University of California, San Francisco, Lorraine Day. I'm not sure if any of you have heard of her. Yes, Lorraine Day. She was head of the Department of Orthopedic Surgery at UCSF in San Francisco, and she developed an aggressive breast cancer. So she went to her colleagues there, and of course, they told her the standard conventional treatment, and she told them, I don't want that treatment because I didn't develop this breast cancer because of lack of chemotherapy or radiation, right? There's other reasons why I developed this cancer, so let's not put a Band-Aid. Let's put a program together where we could work on the underlying causes. So in life, it's all about balance. The medical word is homeostasis, equilibrium, right? Balance. When that balance is shifted in either direction, we get colds, we get pneumonias, we get arthritis, we get cancer, inflammation, and so forth. So in life, it's all about balance. And we have here what we call a health zone, where this fluctuates, but we're still in somewhat of an equilibrium or balance. Once that shifts either too high or too low, then disease occurs. And this is what Dr. Brett was talking about in another type of perspective about the growth and the fixed mindset. Here, we're growing and the body is shifting, it's becoming imbalanced as we become exposed to toxins. But if it's fixed and it can't regulate, then disease happens. Okay, so a fixed, static body is one that is more susceptible to illness. So how could we be dynamic? Move, 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 right? A body in motion is a body that can heal. And now studies have shown that if we're sitting down 12 hours a day, our risk factor of getting disease is incrementally, substantially increased. So that's now why they have desks that you're standing upright and working on your computer. But please, please, move every hour if you have a job that requires a lot of sitting. And there's no reason why we shouldn't be moving. A little mini trampoline, those little rebounders, right, very effective to increase lymphatic flow, circulation, maybe even release some dopamine, right? The reward of exercise that Dr. Brett mentioned the word dopamine. So move, 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 move. We need to be in motion. We need to be dynamic. So we won't go into that anymore. So here, these are the 10 hallmarks of cancer. These are the reasons or the things that must happen for in the cancer cell for the cancer to manifest itself. Cancer cells evades and invades the body and spreads. It evades the immune system. It destabilizes your genetic material, the DNA. Cancer cells are survival cells, so they resist death. A cancer cell is programmed to survive. And so we need to address that mechanism to have an effective therapy. Cancer is an inflammatory disease, so everyone with cancer has inflammation. The test that you should ask your doctor to do is called CRP, C-reactive protein. That's a measure of inflammation. And there's one that's high sensitivity, HSCRP, high sensitivity C-reactive protein. The other one is called sedimentation rate or SED rate, SED rate. If these numbers are elevated, there's more chance that the disease, whether it's cancer, arthritis, heart disease, multiple sclerosis, whatever it is, colds, pneumonia, if these inflammatory markers are elevated, then we need to get them down naturally, not with ibuprofen, Advil, steroids, and things like that, right? Naturally. So cancer is an inflammatory disease. Cancer is a cold disease. Have you heard of that, right? Most of patients that have cancer, their temperature, when measured with an oral thermometer, normal temperature, we say, is 98.6 degrees Fahrenheit. We have patients whose temperature could be 97, 96.5, right? So cancer is considered a cold disease. The metabolism is altered, and most, if not all, patients with cancer have low body temperature. This is why some of our therapies is not to come to Beaumont in January because it's too cold, right? So, but heat therapies. We need to have heat therapies. We need to sweat. And we'll talk a little bit more about that later. Nowadays, a growing challenge, I know Dr. Brad and Dr. Bill are seeing more and more patients with thyroid issues, right? Hypothyroidism or hyperthyroidism. And that regulates our thermometer, our temperature as well. So please, everyone here who's 40 or above, especially the females, have your thyroid checked. But not with a conventional doctor because they only look at your blood test. And the blood test is not very accurate to assess your thyroid health. There's many other things. For instance, Dr. Bill was telling me last night that he has a technology called the Zyto. Zyto is sort of an energetic bioresonance device that's very good to assess deeper what's happening in the body. So we need to get more data points, and a blood test is just not enough to assess thyroid health, okay? So these for cancer to develop, the cancer terrain has to be there. So I give an example. This church is very clean, very nice. There's no ants or maggots or anything here. But what if, that's why we shouldn't eat it here, right? What if we eat it here, we leave some food there, and the church closes for vacation or something, we come back in 2 weeks, what do we find, right? Maggots and all kinds of bugs and all that. What changed? Where did these microorganisms come from? They came from a changed terrain, a changed environment. Right? So the same thing with cancer. Cancer is going to form and develop in an environment that will be predisposing, make it easier for it to form. Okay? And these are the areas that can change our internal environment, which is also called the internal milieu. Internal milieu. And that's psycho-emotional factors. Stress, anxiety, unresolved conflicts. And this afternoon, I'm going to feed from Dr. Brett's presentation and go a deeper into the mindset and give you some practical things to do. I think Lucinda is shaking her head, right? Because every cancer has an associated conflict or trauma. Okay, so we'll talk about that. A compromised immune system. Aging, the older we are, the more susceptible we are to cancer. So as we're aging, we need to do preventive work. We need to take supplements. We need to move. We need to sleep more, you know. And other things is acidity. Acid alkaline. We know that cancer cells like an acid environment. So we'll talk a little bit about that. Toxins, and that includes emotional, behavioral toxin. We had a patient in Cancun clinic, and she came with stage 4 lung cancer, small cell lung cancer. These patients, you know, have a very poor prognosis. And her husband, I think they're from Mississippi. Her husband's a medical doctor, and he was, you know, like this, and he didn't want, Pamela is her name, he didn't want her to go there, and she ended up going, and now he's, you know, he's listening up. But I went to the Cancun clinic, and I was doing a question and answer, and I saw that Pamela was there for her 1-year follow-up. 1-year follow-up. And so in the question and answer, I asked Pamela, can you tell the new patients in the room and the companions, what is the number one thing that you did when you went home to improve your prognosis, to do the therapies well? And she said, I told my best friend of 20 plus years that I couldn't see her anymore. She was a nurse, her best friend a nurse, they loved each other, but it was a toxic relationship. It was a toxic relationship. And Pamela was always stressed when her nurse friend told her, why are you doing, you know, alternative therapies? You should be doing chemotherapy. And, you know, eating that way, that doesn't matter. Let's go to McDonald's or whatever, right? And so Pamela said, I had to tell my dear friend of so many years in a loving way that, you know, distance ourselves from each other. Maybe in the future things will change and, you know, we'll get back together. So some of the choices that you have to make are not easy, but they are very important. And they can make the difference between a successful outcome and an unsuccessful outcome. So imagine how tough that is. And that could be a husband. That could be, I'm not telling you to distance yourself from your husband, but I'm telling you to work it out and to communicate and to figure it out. Come to the church, speak to Pastor Jeff or a good friend, you know, your mom, your family, but it has to be worked out because you cannot heal. And if you don't have cancer, we still have to do that because we don't want to have cancer. 1 in every 2 men will have cancer sometime in their lifetime in the US. and 1 in every 3 females. But of course, no one in the room. Those are outside statistics, right? Not in the room. So we need to do these things not only for treatment, but for prevention. And now is the time to make those hard choices, and let's live a life full of hope, joy, love, faith, and gratitude. And it could be tough choices, but they have to be made. They have to be made. Deficiencies, nutritional deficiencies, a big one. Because even if we eat organic and we have a beautiful garden here in a part of the country where you could grow, beautiful gardens, the soil is not enough, is not rich enough nowadays to give us all the nutrients we need. So we must supplement. We must supplement. And I encourage you to, there's a lot of smart people in the room, but try to get some health practitioner to guide you in supplementation, because you can't take that for granted. Go to Costco or just go online or Walmart and say, oh, it says organic, I should take this, and that. Get some guidance, get testing. What are the deficiencies? What are the excesses in your body? And that way we could be focused and not just take a supplement because it looks good, right? Or it says vegan, no GMO, organic, and all that. We need to focus. What you need is different than what I need, right? And the dosages are different. So 1,000 milligrams of vitamin C may give you diarrhea, but it may not give me diarrhea. So we need to adjust dosages and make it very individualized, okay? What else do we have here? We have hormonal balance. Hormones now are a big challenge because of xenoestrogens in the foods, plastic bottles, toxins, and so much. So please, go to a healthcare practitioner who really understands hormones and get that done. It's the psycho or the emotional, the neural or the nervous system, the endocrine system or the hormonal system, and the immune system. So this is a psycho, neural, endocrine, immune system. Those 4 systems work together to maximize our health. So if our hormones are off balance or dysregulated, the immune system will suffer, the nervous system will suffer, and ultimately our risk of disease is higher. And maybe some of you here, including myself, you heard of fight or flight, right? We're like sympathetic overdrive, and it's always, we have 1,000 projects, and I sleep 4 or 5 hours. Sometimes I don't give my patients anything that I don't take myself. So what I have to work on is work, right? I was told some of you a funny story. About a year ago, I was home and I woke up in the middle of the night and I'm lying down, right? I'm sleeping, and I wake up and I'm going like this. And my wife Marcy felt me and she goes, "It's me, I'm your wife." So the thing is, I wasn't used to being at home because I was traveling so much and I was sleeping in the hotels. And I'm like, who is this next to me? Why is there someone next to me, right? So find time for the family, find time to relax, and let's not be in that sympathetic, adrenaline rush, high cortisol. We need to slow down. And it's, it's something that we consciously have to do. So please remember that. Dental. Have anyone heard about dental toxins, right? What are the 4 main dental toxins? Metal fillings, root canals, cavitations, and periodontal disease or hidden infections. So let's go over the 4 of them. Root canals they're all bad, but that's like the bad one. A root canal is obviously when they denervate the tooth. There's no nerve, so what is it? It's a dead tooth. I don't think anything dead in our body is healthy, right? And many studies have shown that 100% of root canal teeth are infected. So it's a harbor for infectious organisms that maybe don't give you a fever, you don't have pain, but there's an infection there. And every second of every day, it's affecting your immune system. So what to do with a root canal tooth? You gotta remove it. Yeah, Dr. Tony, but what do I do then when they extract my root canal tooth? Well, you ask your dentist, because I'm not a dentist, but you need to go to a biological or holistic dentist. These are not the regular dentists who are putting in toxins into your mouth, and maybe partials, or now, they're doing some implants that tend to be healthier, like zirconium or titanium. I prefer zirconium than titanium, but in essence, no dental implant is 100% safe, but at least those are better than having a root canal tooth. There's been many studies that you can look up on Google. By the way, I think Google is a lady. It's a female, because Google knows too much, right? So go to Google or PubMed, and you will find studies that in the same quadrant or meridian where the root canal tooth is, that's where females are getting breast cancer, right? And so there's convincing evidence, and that root canal teeth are dangerous to our health. Number 3 is cavitation. A cavitation is where the tooth was removed, the gum sealed and healed, but there's a pocket, a cavity that we cannot see. And again, that is a haven for infection. So what the dentist has to do is do a panoramic digital x-ray, and then if this is detected, then they go in, they open the gum, and start cleaning that out. And maybe use some ozone, maybe use some hydrogen peroxide, plasma-rich, platelet-rich plasma, PRP, and other things that are natural, effective, that will eliminate the bacteria and infection, and then that pocket will close up. And then periodontal disease, it's about 70% of the population. So if there's 80 of us in this room, 56 of us will have periodontal disease. And it's maybe when you brush your teeth and it bleeds, right, easily bleeds, that's because you probably have some hidden infection in the gum. But you really have to go to a dentist who is well-versed in this field. They cannot outlaw the 4th dental toxin, which is metal fillings, because in the US, there's 1.5 million metal fillings or amalgams that are placed every day. So imagine if the American Dental Association said, oh, metal fillings are toxic, a recall, it will crash the dental community, right? It just can't handle it. So metal fillings continue to be placed. I have a friend in Florida, and she was in the waiting room in the dentist's office to get a checkup, and there was a sign that has to be put in the waiting room in Florida saying that metals and mercury is toxic. By law, they have to have this sign. So she's in the waiting room. Finally, she's called in. The dentist examines her, and the dentist tells her, we have to place a metal filling. And she's like, what is it? Mercury and other metals. She said, but I just saw the sign in your waiting room, and you're telling me that's what I have to do? And the dentist said, well, we have to have that sign there for legal reasons. So be very, very careful of dental toxins. Well, God is telling us to take a break, I think, because this is not working. Jeff, do you know what's happening? The clicker is, we'll take a break in a few minutes. How are we doing? Okay? Can you put the next slide, please? So, any questions at this time while we figure out what the next slide is? Oh, here it is. Well, let's take a break now, but let's entertain some questions. Are we good for a break now? Or should I go on? Break? Okay, so any questions from part one of this morning's session? And don't be afraid to, yes, Dr. Brett? I don't hear very well, so if you could please,
So the concept of the paradox of disease, can we elaborate a little bit on how not only does that harbor the potential for cancer, but also other diseases like Alzheimer's?
what was the first part of that?
So in regards to the paradox of diseases and
Okay.
microbes,
Okay.
how that relates to other diseases.
So Dr. Brett is asking or suggesting for me to talk a little bit about dental toxins. How does that relate to other diseases, inflammatory diseases, any chronic disease, diabetes, or anything? Within what we know in medicine, for example, I was part of a study in Russia where we took the fluid from the joints of the knee, the synovial fluid, of patients that had advanced osteoarthritis of the knee. And we found, and that study was about 300 patients, we found that 80% of those patients, 240 of the 300 patients, when we examined that fluid, they had 2 or more of 7 pathogens. Mycoplasma, Giardia lamblia, which is a parasite, Epstein-Barr virus, cytomegalovirus, rickettsia, and 2 others that I don't remember at the moment. But the fact is that osteoarthritis of the knee, and it could be anywhere, the elbow or any joint, was fundamentally caused, in this study's conclusion, by microbes. So having a dental area that has microbes, whether it's bacteria, fungus, or any other thing in there, that increases the risk of any disease that ends in itis, any inflammatory disease, right? So microbes increase the risk of heart disease, cancer, arthritis, lupus, ALS, also Alzheimer's and Parkinson. And I know that last week you had a brain seminar and you learned about, the ones that were here, a lot about Alzheimer's. So that's another neurological disease that has been linked to pathogens. So for sure, these dental toxins have a lot to do with other diseases in addition to cancer. The metal fillings, they disrupt the energetic flow of what the Chinese call the meridians, right? And we have energetic centers in our body called chakras. So when we have a metal filling or a root canal tooth, that is blocking the energy flow. It's blocking that meridian, and anything that blocks energy flow or the chakras is making you susceptible to a disease process. Everything is about flow, right? We have to flow, right? We have to flow smoothly and well and healthy. So make healthy choices and go to a biological dentist who really knows how to remove these toxic materials. Because if you go to a normal dentist, he or she won't do the right procedure to remove these dental toxins. They will seep into your body, into your bloodstream, and potentially cause more havoc. So I'd rather you leave them in there if you haven't found yet a dentist who can remove it safely. Okay? Any other comment? Yes, sir?
You said on the thyroid, you did a check. You said don't check it.
The thyroid?
Yeah. How do you do a check?
Well, you go to a holistically minded physician or practitioner, and I mentioned, like Dr. Bill told me about the Zyto technology that he has. So, you know, they do energetic testing and blood testing, maybe some urine testing also. So it's much more than what a conventional doctor will do. Because solely the blood test is not enough. The blood test will tell you what hormones are circulating in blood, not necessarily what's happening in the thyroid gland itself. Yes.
What's the best way to test the hormones? Is it the saliva?
So,
To test the hormones, what's the best way?
to test the hormones, what's the best way? I like to do saliva. I like to do urine, 24-hour urine test. There is a lab in the Seattle, Washington area that I like very much. I'm not sure if you've heard of Dr. Jonathan Wright. He's a brilliant older physician, and he has a lab called Meridian Valley Lab, and that's in the Seattle, Washington area, and they do what I consider the best assessment of hormones. Meridian Valley Lab, and it's a urine test, so you contact them, they'll send you a kit, and you collect your urine for 24 hours on a specific time. Of those of you that are still menstruating, it has to be a specific time of your menstruation, and then you send this urine sample back, and it takes them about 3 weeks to give you a full description, and then they have naturopath doctors that will explain it to you, and then make recommendations.
Do you have to be a physician to order it?
No.
Yeah.
No, you could just give them my name, and they will, maybe I'll have to send a prescription, but we could do that. Oh, yes, one more question.
When you're talking about the cancer stem cell test,
Yeah.
and all of us have the cancer stem cells.
Yes.
You're saying,
Yes.
so we'll get this test done and there's these levels. Is it per person, like you get a baseline and then if you're going to have breast cancer, sorry, that's computer cancer. If you keep what is it going to tell?
So she had breast cancer, she had the chemo diagnosed a year ago, and she wants to know that the circulating tumor cell of the cancer stem cell test, what is that going to tell you? It's going to tell you how many circulating tumor cells, cancer stem cells, are in your bloodstream. The higher that number is, the more risk you have of these cells going to the liver, going to the lungs or the bone, and forming what is called a relapse or recurrent. So it's a good idea for you to have this test done to see where you are as a baseline and then to be proactive. But you can start being proactive now with some of the things that we'll talk about in the second section, the 7 key principles to cancer therapy. Number one, of course, that we all should do is healthy eating, right? There are nutrients in foods called phytochemicals that have been shown to kill cancer stem cells. And I will describe some things that you can do, treatments and or supplements that kill cancer stem cells. Did that answer your question?
How often should you repeat the test once you have a baseline?
Depending on what was your baseline. If the baseline was moderate to low in the reading of the cancer stem cells, then maybe every 6 months. If the number was higher than mid-range, then do it in 3 months because it's unpredictable how quickly they can lead to a recurrence and settle somewhere in some organ. So at least every 3 to 6 months, no sooner. Okay, I hope this was useful for you. We'll take a little break and then we'll continue.